Hello everyone, greetings from Seashell Logistics. On the occasion of Hypertension Day, we are excited to announce a special knowledge session focused on relaxation and stress management techniques featuring Dr. Nikhil Parchure. Could you provide a brief explanation of what hypertension is and why it's a significant health concern, sir?
Hypertension is called silent killer,
Okay.
which itself explains that how dangerous this condition is.
Okay.
So blood pressure beyond a certain limit
Okay.
can be very dangerous in terms of damage to all the organs in the body. It is universally present.
Okay.
In majority of the patients, there is no cause for it.
Okay.
Only a minority of patients have some underlying correctable cause,
Okay.
and that's why the blood pressure is found to be on the higher side.
Okay.
That individual needs to be seen by a cardiologist,
Okay.
assessed and investigated, just to find out if there is any underlying cause which is correctable.
Okay.
Majority of these patients do not have any symptoms,
Okay.
but they're harboring this high blood pressure. I
Okay.
can give you a small example of it.
Okay.
40% population of Greater Mumbai is actually hypertensive. 20% over and above is newly diagnosed hypertensives. And 10% above it is what we used to call pre-hypertensives. So majority of the population in Mumbai and Greater Mumbai are actually hypertensives.
Oh my God.
The big problem of hypertension is that because there are no symptoms,
Okay.
patients with high blood pressure do not want to take any medication by telling me that we don't have any problems.
Okay. There are no symptoms.
There are no symptoms.
Okay.
So that's why this is big misconception that I don't need the treatment,
Okay.
despite the blood pressure being on the higher side. That leads to a long-term slow damage to three main organs in the body, which is brain, heart, and kidneys.
Oh.
Uncontrolled blood pressure sometimes goes very high, and then these patients get symptoms of dizziness, giddiness,
Okay.
blurring of vision, and headaches.
Okay.
We see almost every day one patient coming to the casualty
Okay.
with these symptoms, and we find their blood pressure so high that we call them hypertensive emergencies.
Okay.
That untreated, they would probably get a stroke.
Oh my God.
And we admit these patients into ICU. So these people who do not take treatment at some their blood pressure is still not controlled.
Okay.
For these patients, we do a procedure nowadays called renal denervation therapy.
Okay.
It's a catheter-based intervention where we take a catheter inside the renal arteries and create what we call small radio frequency ablation so that the nerves surrounding the kidney arteries are damaged.
Okay.
So sympathetic denervation happens and that leads to lowering of blood pressure.
Okay.
So renal denervation therapy is very promising at the moment for at least a subgroup of patients who have resistant hypertension despite being on 3 or more medication. There are a large number of people who have high BP,
Okay.
but they are not aware that their blood pressure is highest on the side.
Okay.
Those who have been diagnosed as hypertensive, I would strongly advise them to follow advice from their doctor, nutritionist, dietitian and physiotherapist to change their lifestyle,
Okay.
which can lead to blood pressure lowering.
Okay.
Next is to take regular medication.
Okay.
The problem is that these patients are not very compliant because they do not have any symptoms.
Yeah. That's
So at some point they just stop taking medication. So not to do that, but to regularly keep medication and regularly keep a record of their blood pressure to make sure that their blood pressure is within the limits which we think is safe for them.
Okay. And what is that safe?
Generally speaking, blood pressure should be below 140, the upper one,
Okay.
below that, and 90 and below that.
Okay.
That's a general advice. Blood pressure should be routinely checked whenever you visit your GP or a hospital,
Okay.
or you get your health checkup once a year or once 2 years. The blood pressure is always checked.
Okay.
So whenever you visit a doctor for any reason, for cough and cold,
Okay.
it's an opportunity to check the blood pressure.
Oh, yeah, that is true. Sir, would you like to give any like 3 tips like for youth that workload and everything leads to hypertension? Do you think that like we work like straight 9 to 10 hours? So some tips to keep tension-free life?
This is a very good question you have asked.
Yeah, thank you so much.
So modern day living
Yeah.
has its own stresses. As you said that we are so busy in our work in cities
Yes.
that we do not have time for ourselves.
Yeah, sir, that's
In
so
terms
true.
of healthy diet,
Yes.
in terms of relaxation, and the very big problem of lack of sleep.
Yeah, that is very true, sir. Very true.
So time management is of essence,
Okay.
where we have to manage our time in our professional life. At the same time, we have to look after ourselves in terms of drinking plenty of water,
Okay.
eating healthy diet,
Okay.
taking time out for relaxation and exercise,
Okay.
and sleep at least 6 to 8 hours per night.
Very nice, sir. Very nice. Okay, sir. Finished with finally, as we observe World's Hypertension Day, what message would you like to convey to our audience about the importance of addressing hypertension and prioritizing health, heart health? Yeah.
As I said, hypertension is a silent killer.
Yeah.
It's extremely common in the population. So there are 2 things important, is lifestyle maintenance,
Okay.
and number 2, regular checkups, and if blood pressure is found to be on the higher side,
Okay.
is to follow the advice of your doctor in terms of lifestyle changes and regularly keep taking medication without discontinuation of the medication.
Okay. Thank you so much, sir. Thank you for sparing your wonderful time, sir, from your busy schedule. Very warm regards from Seashell Logistics family, sir.
Thank you very much. Thank you.